we have a couple of buckets. You have like the background, you have like the research objective, you have the methodology, and the final session was really like your findings or hypothesis. So in the background is where you have done like background on what your research topic is. I know when you had the session we said to her, he was like, don't put too much background information. And that's why we just put a very small space for you. Just briefly, tell us about the background of your research, what it's about, what's the field about, something like that. Basically, the background, right? Just the same way when you were applying for this, you had some background information, but just really make it very concise because it's just a one pager. Then your research objective, that's where you're going to state what's the objective of why are you doing this research? So in simple terms, that's the question. Why are you doing this? Why is this research important? What do you hope to get out of this research? So most times we have like primary research objective, secondary research objective, but make it concise and put it in that bucket. Then the other two were the methodology. I think we had a session on methodology last week, Saturday, and you were taught about what method are you going to use to find out your research. So do some brainstorming, think about it. Some of you already have this, some of you have started your research, some of you are just starting, some of you are in the middle of the process. So look at what you have, and if you need to refine it or rephrase it, just do something very simple and put it in that section. Then the last section is the finding and or analysis slash hypothesis. So we have that because some people have not completed their research. So if you have completed your research or you're almost completing your research and you have some preliminary findings, you can put it there. But if you've not even completed or if you've not started your research at all, you can make it like a hypothesis. What do I hope to see, right? Based on the research findings in other markets or in other economies, what do I expect to see, right, from this research? So that would be what will guide your that's bucket of the abstract. So really it's just something very basic. So on the last day, I just also want to make an announcement that we won't be having a session on Wednesday. We will combine the topic on Wednesday just to give you enough time to work on that abstract. We'll combine the session on Wednesday with Saturday. Saturday will be the final day of this training and the research challenge. That's where we will announce the winners of the grant. Also, we would have a career session. Thought leaders and experts in public health will come and speak to us. That's where you need to come with your questions. If you have questions on how will I become great in my life, how can I position myself? I was hoping to do a separate session for everyone just to tell you what I wish I had known in my undergrad, but I don't know if I'll have that time because I think I have something on that Wednesday. So that's why I'm moving it. But perhaps maybe next month or another time I can reach out and those who are interested can, join the session, to just tell you what you can do, right? And I really want to commend a couple of you who are already doing. I saw some people have already started posting on LinkedIn. People who didn't used to post on LinkedIn started posting. People who did not used to, reach out have started doing that. Some people have reached out to some of the mentors, some of the facilitators. So keep doing that. That's the best way to apply the knowledge you are getting from this. Some people have opened their Google Scholar. Someone reached out that, hi, I've opened my Google Scholar account. It shows that people are actually doing it. And we hope that, I'm very sure that if you apply all of this knowledge, right, I said it's a gift of exposure. That's what we are giving you. The gift of exposure. It might not be like, everybody might not win the ground, but that gift of exposure is something that, I wish I had during my time, but I didn't have the opportunity. And that's why we are doing this research challenge. So yeah, thank you for listening. I think that was just preliminary, like open breaker for questions I've received over the weekend. Right now, I'm going to call on our speaker for today, our facilitator. Yeah, somebody says, when are we submitting the abstract? Oh yeah, so it's really it's just to prepare you, right? It's not really, it's just to make sure that you practicalize. And like we said, the people who win the grant, right? We're going to call, nobody knows whether you're the one that win the grant or not. So if we call the top 5 people and they are not ready to present tell us what they're working on in the group, the next people on the line will definitely, so just prepare, right? And also, at the end of the day, if you want, you can also do like a short mini video or a short presentation of your abstract. We can help you to post it and push it out there. We're going to create like a working group for everyone so that you just keep in touch. And, like I said, if you want to take your research beyond just shelving it, we can help you to do that even when you are done with your research, if you want to do a publication, right? You can always stay in the hub and reach out and say, hey, isn't it? How can I publish my research project, right? How can I get it out there? So yeah, So really, there's no deadline to submit. Just have it handy by Saturday so that you can present. So yeah, today's session is going to be from data to insight. We have our guest already. Samuel, are you here? Yeah.
Yeah, I'm here.
Awesome. So do you want to come on camera or perfect?
Yeah.
Yeah, so today's guest is Mr. Samuel Lateef, and is going to be teaching us on from data to insight, mastering data analysis in health research. Well, Alisa, yes, I see your question. Yes, if you check the email that was sent out on Sunday, there's a link to download the template there. But I mean, you can always reach out if you don't find it. So yeah, Samuel A. Lateef is a public health informatician and data scientist whose academic and professional work bridges medical microbiology, clinical research, health policy, and applied data science. He holds a master's in public health and a postgraduate diploma in public health informatics from Johns Hopkins University with a focus on epidemiologic and biostatistical method for clinical and public health research. Applies quantitative analysis and AI-driven methods to address complex public health challenges, particularly in infectious disease surveillance and antimicrobial resistance. With nearly a decade of experience across academic and governmental settings, he's deeply invested in the intersection of AI and global health. Samuel is passionate about translating data into evidence-based policy and mentoring the next generation of health professionals. As you can see, there's a lot in his bio already. We have AMR, we have AI, we have data analytics, we have microbiology, we have data science, we have epidemiology, biostatistics. Please, let's give him a virtual clap. Let's welcome our guest today, Mr. Samuel, for taking out your time. I know he's working. I think he's currently based in Canada, but he made out time to join this session. So thank you, Mr. Samuel, for joining us for this session. So over to you, sir. Thank you.
Thank you so much, Izine. Thank you for having me here. Super duper pumped to be here. So a few weeks ago, Izine just tapped me on the shoulder and was like, "Hey, Sam, I have this thing going on, and I would like for you to talk about data, especially as it relates to healthcare and data to insights." And being a data person, the moment she mentioned it, I was like, "Yeah, I'm going to do that. I'm really interested in that." So I'm really super duper pumped to be here. It's lovely meeting you all. And I'm glad that there is a generation of undergrads, especially in our LMICs, that's low middle income countries, who are really interested in doing work that really matters. People who are interested in doing research that moves that moves science forward. So I'm really glad to be here. If you can hear me and you're with us, can you drop some 888? Let me see. Let me see that you're with us. Can you drop some 888 in the chat? 88, yeah. Good, good, good. I see Brenda, I see Abigail, I see El Menora, I see Abasiuko, I see Anita, Israel. All right, so let's move it forward. Else
Okay.
now.
Yes.
By just randomly coming off your mic, can you just, if you're not from Nigeria, can you just introduce yourself? Let us know where you're calling in from. So are we all Nigerians here?
We also have Malawians.
Malawians.
Yeah. Yeah.
Interesting. Thanks for joining us, Alisa.
I'm also bienvenue Concord
Yeah.
Rwanda.
All right, I see Mary from Ghana. I see Bienvenue from where?
Yes, bienvenue from Rwanda.
Rwanda. Interesting. Thanks for joining
Yes.
in.
Brenda Chabwela from Malawi.
Malawi. Thanks for joining in. So I can count Florence from Ghana. I can count like 4 or 5 different. Oh, Uganda, 6 different nationalities. Thanks for joining in. By show of hand in the chat, can I know if you've used data before? Anybody from anywhere? If you've ever used data, can you just drop someone in the chat? Yeah, data. I have great. So we have all used data one way or the other during the course of our lifetime. And we know how important data is. So now we are talking about making sense of health data, making sense of data in healthcare settings. the principles and practices that guide the analysis and interpretation. Short info about me, like Ezinye has said, public health informatician. I did medical microbiology for my undergrad, and then I also went on to do applied data science. And then I started working at the intersection of health and data science. Somehow I find data really interesting because it helps talk about the past, it helps predict the future. So in a way, you're a prophet because you can predict the future, and then you're a storyteller because you can tell what has happened. So sometimes I tell people I'm a prophet and a storyteller, and you can reach out to more people with predictions. You can affect more lives with predictions and global data, which was what led me to do my master's in public health. I also did my diploma in health informatics in the same school. It's interesting all along. Let's just dive right in. So in my short academic journey around the world, I have found that one of the most effective pedagogical approach to teaching is using the interrogative method, asking the what, why, and how, right? You find that if you do that a lot, you're not just learning the figures or the facts, rather you are learning the principle of a thing, such that in any situation you're able to apply the principle. So that's the approach I'm going to be using today, the what, why, and how. What is data? What is data analysis? Why do we need it? Is it important? How does it affect our lives? And then if it's so important that it affects our lives, how do we go about doing data analysis? Does that make sense? Does that make sense? You can come off mute and talk. I want this to be an interactive session. When I ask questions, every now and then just stand. Okay, I see some responses. Great. Thank you. Thank you. Thank you. Thank you. Right. So what is data? What is data analysis? Data is a collection of figures, facts, information that can be stored, it can be processed, it can be analyzed, and it can come in different formats. It can come as a numerical format, it can come as non-numericals, it can come in form of audio, video, images, things like that. All right, so in my primary school, I learned that data is a raw fact that is yet to be processed. And over the course of my life, I found that that definition has not really changed. It has been accurate, it is accurate, and it's going to be accurate. So data is a collection of facts, it's a collection of figures that can be stored, can be processed, can be analyzed to gain insight, to tell a story of what has happened, to predict what will happen, to describe what is currently happening, and to plan for it, right? So that is what data is. It's any information that is not processed. And analysis, according to Merriam-Webster, is a detailed examination of anything complex in order to understand its nature or to determine its essential features, right? So IBM even said that data is a collection of facts, figures, numbers, words, observations to make better business decisions, right? You analyze it, you organize it, you transform the raw data to make valuable insights and to improve decision making. On the right is a picture of what some people call nonsense. And this is what I'm talking about. I'm going to be pointing to it here. Some people will call this trash. Can you see my pointer?
Yes, sir.
Right. But this is exactly what data is. In its raw format, it's like trash. You can't make sense of it. Audio data, images, text, you can't make sense of it. So why, if we can't make sense of data, why then do we need to learn data analysis? To explain, I'll tell you that data analysis is always very important because evidence is better than assumption. Imagine the WHO spokesperson comes out to say there's going to be lockdown worldwide because there's a pandemic, although we don't have an evidence of pandemic, but it was revealed to me in a dream that there is a pandemic coming. So there's going to be a global lockdown for the next 3 months. Everybody will be like, this man is crazy because there's no evidence. You're just talking based off assumption, which is why in our daily lives we need evidences. So evidence is always greater than assumption. That is where data comes in. With data, we are able to detect problems early. We are able to know what is working in order to bolster it and it keeps working, and what doesn't work in order to change our method of intervention. In healthcare, if you're talking about, let's use COVID-19 for example. If you're talking about during COVID-19, some were saying if you have your bath with salt water to prevent you from getting COVID-19 and all of that. But there is no evidence to support that. So that intervention does not work. So with data, we can say that that intervention doesn't work. So data is important to help measure what works and what doesn't work. It helps in accountability and policy decision making. It helps in predicting the future. So in health, in global health, in every decision we make, whether it's from vaccine to budget, it should be backed by data. Without analysis, we are going to be flying blind. But with data and accurate analysis, we can save lives smarter, faster, fairer, millions at a time. Because you don't want to go make a research and make a presentation and people are asking you questions. So why did you do this? Why did you decide to do this and that? You're like, well, I got the advice from a madman. No, you need data to back up whatever it is you say. You need data to back up whatever decision you're making. So it is important to know how to analyze, right? Let's use real life examples of when we've used data to analyze and how it has helped us. A prime example is what we all faced during the COVID-19 pandemic, right? With data, and now this is the data from Johns Hopkins, COVID-19 surge versus ICU capacity. You can always find this data. The link is down here. You can always find this data. And so the concept is getting data from whether it's daily counts, testing positivity rates, hospital admission rates, and then cleaning up the data, applying analysis methods, analyze it, predict models that will help forecast ICU bed needs, make dashboards, and then you can make decisions. You can say that we foresee that older people would likely need hospital bed. So let's make room. Let's make immunocompromised people would likely need hospital beds. Let's make room for them. And you can prepare for what is to come. You are able to prioritize older people, immunocompromised people, and that's because mortality data has shown that they are at higher risk. So these are some of the importances of analyzing data. Another prime example, something I'm particularly interested in is AMR, antimicrobial resistance strain. I find it really interesting. That was what I did my undergrads researching some years back. I think that was 2017. Until now, it's a world scare. It is something that scares everybody, whether in healthcare, whether you're a pharmacist, or you're a doctor, or you're a surgeon, whatever, right? Antimicrobial resistance is global health care. If you check it today on WHO or CDC, you will always see how they describe the AMR as, world scare. Everybody is afraid of it, especially now that almost anything is transplantable, from your heart to your liver to your kidney to your to any part of your body, almost transplantable. Imagine having a very successful series in the theater, but the patient died because of infection, simple infection, because the patient is resistant to whatever antibiotics they are given. That was what piqued my own interest in AMR. So with AMR data collected over several years, we are able to see the resistance. This is a chart for E. coli resistance to ciprofloxacin, right? You're able to see it between 2010 and 2020, how it has continually increased. And then you're able to prepare for it by doing more stewardship, more education, whatever it is that's needed. This is another situation where data and data analysis is important. Data scientists are able to aggregate lab results to detect resistance pattern. They're able to do analysis to reveal whether resistance is spreading. The impact of the result is that national governments, WHO, subnationals can use this analysis to update antibiotic prescribing guidelines, directly saving lives by discouraging use of ineffective drugs and abusing OTCs. Another life example is the maternal health outcome. The concept is that maternal mortality is a key public health indicator, but raw numbers cannot tell the story. In short, it's going to be very difficult to understand raw numbers. Imagine seeing a spreadsheet that contains information from 2000 to 2025. How are you able to make any sense of it? It's going to be difficult, it's going to be time consuming, and explaining that to a heterogeneous audience is going to be difficult. But with analysis and infographics, you can do that very simply. For example, just with this infographic in your front, you can tell that there is higher maternal mortality rates in rural settings than in urban settings, right? So that is one of the importances of doing good analysis and doing report on it. You're able to stratify, you're able to use your statistical models to tell what is happening, see what the data is saying. For example, according to WHO Global Health Observatory, if you go there right now, you're going to see that based on what I saw 2 days ago, Nigeria has the highest maternal mortality ratio per 100,000 live births, at least based on all the countries that they were able to show. Not all countries has data, but based on the countries that are providing data, Nigeria has the highest maternal mortality ratio. That's crazy. That is 1 in every 100 births, the mother dies. With that information, a lot can be done, right? You can improve skills of birth attendants. You can improve the quality of health services received in rural settings. You can improve the health facilities in rural settings. A lot can be done with such information, right? Another life example is the cholera cases in Haiti between 2010 and 2017. Here's the background. They had an earthquake in 2010, and then they began to experience one of the worst modern cholera outbreak in the world. In 2010, a lot of people were dying, and then epidemiologists began to collect data, and they were able to use spatial analysis and case reporting to map hotspots in real time, right? They're able to predict where the outbreak was likely to spread next, allowing targeted deployment of water purification and oral rehydration supplies. What's the impact? Instead of spreading unchecked, interventions focused on high risk areas, which significantly reduced deaths. And what's the lesson? It's not that data stopped the cholera, but analysis. Like I said, data can be trash if you're unable to analyze, if you're unable to make insight out of the data. It's like a knowledge you have, but you don't even know how to apply, right? So it's not the data that stopped the cholera, but the proper application of insights gleaned from accurate analysis. And if you see the trend line, between 2011 and 2017, it began to plummet. And by 2017, it went all the way down to 0. This is one of the impacts of data analysis. Although right now, in 2022, October 2nd, Haiti began to experience a resurgence of cholera, after more than 3 years of no reported cases. It's evolving rapidly and spreading to all parts of the country. But if it's been done before, it can be done again with data and proper analysis and preparation for what's going to come. I'm sure they're going to be able to surmount even this challenge. So we've talked about what data and what data analysis is. We've talked about why we need to do it. Now the question is, if we see that we need if we know something and we see that we need it, how do we do it? That's the next thing. How do we do proper analysis? So that takes us to the next slide. It's a whole journey, the data analysis journey. So I'm going to be using the conceptual framework of a regular data analysis. It goes from data collection to reporting, right? The first thing is get data. The last thing is act on the data. You act by reporting to maybe stakeholders, subnationals, you publish it, you do a lot with it, and policies are going to be made from what's your results. So between the data collection and reporting, what are the things that go on? The first thing is data collection. According to Google has a nice model for data analysis. It's called APASA, Ask, Prepare, Process, Analyze, Share, and Act. It's a very interesting model that I use all the time, right? What are you asking? You're asking for what the problem is. Someone taps you on the shoulder, like, okay, all of you are currently doing your research, your final year research. Can anyone just tell me maybe what their research topic is? Can someone just come off mic and talk about it?
Yeah, I'm Alice from Malawi,
Okay.
doing biomedical laboratory sciences at Mzuzu University. So my research is on AMR, antimicrobial resistance of Candida auris. That is bringing too much. That is bringing problems to Malawi and worldwide. So it's also a pandemic on. It's also a critical pandemic on CHO list. So yeah, it's AMR, antimicrobial resistance.
Thank you so much for that. So someone is working on antimicrobial resistance, particularly focusing on Candida, right? So the question you want to ask is, what data do I need? If I want to focus on AMR, particularly Candida, you are going to ask a lot of questions. What data do I need? Who is affected? Where do I get the data from? Right? Who has this data? So that's the first step. Asking questions. You want to ask what is expected from, like, what are we looking to experience and what are we currently experiencing? What's the gap? Is my data, is my results going to bridge the gap? So you're asking all these questions. What's the purpose of this analysis? Is it worth it? If from the get-go you find that doing this research is not worth it, there is no need wasting your time and money. That is where asking comes in. You ask a lot of questions. So part of the questions you ask is to get data. Where do I get data on Candida? Of course, if you're interested in data on Candida, where you need to focus on is lab results, maybe surveys, EHRs. You can't go to sports center, you can't go to the stadium to get data on Candida. You're not going to be going to the market square to get data on Candida, right? So it is part of asking questions that you know where to get your data from, which is the first step of the framework, data collection. What are the sources of data in healthcare? Common popular sources of data is EHR, electronic health records, surveys, lab results, registries. You can also scrape data. So you can scrape data from WHO sites, CDC, NAMS. You can scrape data from anywhere my capstone in Hopkins, I script my data from both WHO and CDC. So if it's something they have, you can script data from it and do your work with the data you glean, right? So you see, the first step was getting the data. After getting it, you sort it. So I'm trying to point your attention to sorting, right? Which is after collection, it's the next thing, data cleaning. Under data cleaning, you do a lot of things. So you get your data, you clean your data. So a prime example, if you're working on Candida, like she's currently doing in Malawi, and you're getting data from EHR, electronic health records, you're getting data from different lab results from different hospitals in different regions of the country, you're gleaning data from WHO, from CDC, from online sources and all of that. The first thing you will find is that all these data structures are not going to be the same. They don't have the same number of variables. They are not showing the same thing. You have all this data, but it's a messy data. So after you gather your messy data, you go to what we call data cleaning and preparation. Why do you need to clean the data? Because garbage in, garbage out, right? On the streets. So what does garbage in, garbage out mean? Garbage in means if you put nonsense into the system, you'll get nonsense back. You know, in the corporate world, they will say play stupid games, win stupid prizes. And on the street, they say fuck around and find out. Because you don't want to do that, you want to do proper garbage in so that your garbage out will be proper. That is why you need to clean the data set, right? Cleaning the data set, from my experience, and a lot of data scientists or analysts will tell you, it's one of the most important phases of the whole data pipeline. It takes about 50 to 70% of your time because cleaning is not easy. You sort, you arrange, you do some analysis, you do a few things in cleaning. So cleaning is one of the most important steps in your data analysis journey. In this phase, you seek data that are relevant to the problem you are looking to solve. You seek that the data you got is making sense. Ability matters. If you're getting the health data and you're reading temperature and you are seeing 100 degrees Celsius, 300 degrees Celsius, it's not making sense. Reading temperature cannot be 300 degrees Celsius. So you need to, this is one of the things you do while you're cleaning, that it's making sense for the use case. If it's about temperature, it has to make sense. If it's about height, you're talking about somebody's height, you can't expect to see 13 feet. You know, so you need some background knowledge, you need collaboration with domain experts sometimes. Sometimes you need to do your own personal research to see what's obtainable. Here you do processing, it involves data wrangling, transforming to remove inaccuracies, remove errors, inconsistencies, and the aim is to prepare the data for analysis by addressing any issue that could undermine the accuracy of the results. Because you are not getting the data just to have the data. You are getting the data to have an insight. And if your insight is going to be undermined by inaccuracies, you need to take that out of the way, right? If all of that is done, then you're ready to analyze. You go on to what we call exploratory data analysis, EDA. Here you seek to understand the shape, the structure, data. You try to check relationships, all those little things. You try to see it. And then you go on to statistical analysis. One of the most important aspects of data analysis is statistical analysis. You're trying to summarize, you're trying to find patterns, you're trying to understand relationships that exist. Can you hear me? 333 if you're with me. Go ahead, we can hear you. Okay. All right. Thank you. I see that you're still with me. Right. So you go on to do statistical analysis, you do exploratory data analysis, statistical analysis. With EDA, it can be descriptive, you want to see what has happened. It can be prescriptive. You want to tell how things should be done. It can be predictive. You want to forecast into the future, all these different things. And then you go on to interpret and communicate your results. This is where numbers are turned into meaning. The number you're seeing is meaningless until you're able to make it make sense, like they say. This is where sharing comes in. You're able to communicate your findings to stakeholders. You do this usually through visualizations, you do charts, you do graphs, you design dashboards, you make information easily accessible and understandable to a heterogeneous audience, whether it's policymakers that are looking to make policies based on your results, or it's your supervisor in school who is looking to collaborate with you and publish what you've done, or it's, just some NGO who need information based off where they've been putting their money. If you have sponsor, they've been sponsoring you, they need to see what you've done with their money. So we move on. I'll take a deeper dive into what data cleaning is, because like I said, it's one of the most important aspects of data analysis. So let's just take a deeper dive into data cleaning and see what it entails. In data cleaning, like I said, it takes 50 to 70% of your time. And it is one of the most important phases of data analysis process. It requires your time, it requires your attention, it requires attention to details from domain knowledge experts, and it takes 70% of your time, because the accuracy of your analysis and the ensuing report depends on the accuracy of the process. So data quality matters, right? Also, this is the phase that is most susceptible to bias of misrepresentation or misinterpretation. Because of all of this, you need to put in your time, you need to put in your efforts and your attention. What do you do during data cleaning? You want to remove duplicate data in order to avoid overrepresentation or underrepresentation or skewness. You don't want your data to be skewed. If one data point is being represented 10 times or 15 times in a whole data sheet, you want to remove duplicates, right? You want to remove null values. You want to remove inconsistencies. If you're expecting to see name, and names are supposed to be numeric strings, Samuel, Abigail, Bienvenue, right? These are names. And then under the name column, you are seeing 1, 2, 3, 4, 5, 6, 7, 8. You know that something is wrong. That's not supposed to be a name. So it's under this data cleaning that you take care of all those inconsistencies and inordinacies. Some data sets or some data sources are outdated. If you're looking for information in modern times and you're getting information from prehistoric time, maybe Stone Age, that data is outdated. If you want to talk about what has been happening in the post-pandemic era, and then you're getting data from 2014, 2015, you know that such data is outdated. Someone is not seeing the current slide on data cleaning. I'm able to see it on my monitoring screen. Who else is unable to see the current data? Current screen. If you're able to see my screen, I can see. So maybe you need to log out and log in. It's visible here. Yeah, people are able to see it. So I don't think it's from my end. You probably need to log out and log in. Yeah, thank you. So you remove inordinacies, you remove incomplete data. You have to make sure that your data set is complete, because you want to avoid low quality data. Low quality data leads to low quality analysis. Low quality analysis leads to misleading, misinforming insight. And there's no worse situation than that. when you, as the data analyst, you're analyzing the data and you're making a report and you're suggesting to policymakers or you're suggesting to people, the stakeholders who need your insights to make decisions, you're suggesting to them to turn right. And the actual thing should be to turn left. There is no worse situation to be in than that. So you need to make sure that your data is clean as possible. You do all of these things, remove null values, extra spaces and characters, some sources of errors, mismatch or misleading variable name, variable labels, truncated data, misalignment with logic, business logic. So if you're talking about health data, one of the information you might be collecting is maybe heart rate per minute. If there is a normal heart rate range and you are seeing a data set that is 100 times out of range, you know that something is wrong. Maybe they put the point where the point is not supposed to be, or the data is just wrong. So you need to go through it. You need to be finicky about your data cleaning in order to have a very good analysis. Moving on, once you've done proper data cleaning, you then look to analyze. You need to do both exploratory data analysis and statistical analysis. Like I said earlier, this is also one of the most important aspects of data analysis process. So you need to know the kind of data you have, the kind of, so in data, imagine a spreadsheet, you have rows and columns, right? Rows are observations. Each row is an observation, a data point, a person. And each column is an attribute of the person. Let's use the healthcare settings, for example. If you're getting data set for antimicrobial resistivity, right? ID 111, right? You see another variable could be what microorganism is implicated in resistance, what antibiotics susceptible or are potent, what antibiotics are no more potent, right? What are the zones of inhibition? What other information could be needed? You get all of that. You need to know what each variable, the kind of data you expect in each variable. Is it going to be a categorical data? Is it going to be a numerical data? If it's numerical, is it discrete or continuous? For example, age is continuous. You can have from 1 year old all the way to 70-year-old. It's a continuous numerical variable, right? But if you're taking gender and you're coding it in numbers, if you assign male 1, female 2, that's categorical in nature. So you don't expect that particular variable will be continuous. You don't expect to see 3, 4, 5. All you expect to see in that column should be either 1 or 2, male or female. So these are the things you do while doing your statistical analysis. You see that everything is prima proper, then you do your descriptive statistics, you check the mean, the mode, the median, you see what's happening, what's the range like, what's the standard deviation, what's the variance. Here I'm talking about, measures of central tendency, measures of dispersion. There's a lot of information that can be gleaned from that, right? You're talking about interquartile range, you're talking about standard deviation. So you need to understand, you at least need to have an understanding of statistics to do proper data analysis. So it is this understanding that would help you to couch what your research topic is, and then research question, and then research hypothesis, and then correct confidence interval, right? Your research hypothesis depends on what your research question is. Your hypothesis determines what your confidence interval should be or will be, right? From your confidence interval, you begin to talk about p-values. You begin to talk of significant levels. So you need to understand that there are different statistical tests that can be done depending on type of data you have, whether it's t-tests, sample t-test, two sample t-test, peer t-test. You want to check correlation. Are you interested in seeing relationships? Are you interested in regression? Is it going to be chi-square test of independence? Is it going to be ANOVA, one-way ANOVA, or factorial ANOVA? You need to have an understanding of what is to be done, right? If you're going to make inferences. So inferential statistics then begin to talk about sample versus population. Are you getting your data from the whole population or from just some samples? Is your sample representative? Is your sample random? These are questions, pertinent questions that need to be answered, right? Are you checking for correlation versus causation? Are you saying that smoking causes lung cancer? Or there's just a relation between smoking and lung cancer. All these are things that really matter in statistical analysis. You're interested in knowing what effect size is and what practical significance versus statistical significance is. Because sometimes you need to know that statistical significance is not everything there is. It's not the all and be all. Sometimes it is statistically significant, but practically it is not significant. So you need to know of all this. That is where context matters. You need to know how to choose the appropriate statistical technique. If you're interested in cause and effect, you know that you're talking about regression. If you're interested in two nominal categorical variables, then you're talking about chi-square test of independence. If you're interested in two ordinal categorical variables, then you're talking about Spearman correlation. If you're comparing two or more means, then you're talking about t-test. If it's two or more variables, you're talking of ANOVA, whether it's going to be factorial ANOVA or one-way ANOVA. If you're talking about two quantitative variables, you're talking about correlation, right? So these are important factors you need to understand while doing your analysis so that you don't mislead policymakers, you don't publish wrongly, you don't mislead the public. After you've done that, we go on to interpretation pitfalls in healthcare data. This picture on the right is a picture I find very interesting. I've always found it interesting. How data can be weaponized. So as a data analyst, it's a major weapon you have with you. You can mislead the whole world with it if you want to mislead the whole world, right? You can cherry pick data to mislead the whole world. This picture beside it, you see that the media is trying to portray something that is different from what is really happening. What is really happening is that the guy at the back wants to stab the guy in front, and the guy in front is running. But the media, because of the agenda and the propaganda, they are focusing on how the guy is running, and it looks like he's the one who wants to stab. In the same way, data can be used this way. If you're not careful, your data can really mislead. So it's important you learn how to avoid these kinds of pitfalls. It's important to learn ethical considerations in health data. It's important to understand that your data can bias the public, right? So these are things to consider while doing your data analysis. You don't want to cherry pick data. You don't want to pick the data that would support your. While in school, while doing epidemiology, one of my professors taught me in class that you don't expect a particular result before doing your analysis or before doing your research. Going on with the mindset of looking to get a particular result is where bias comes in, because you already have an agenda. And if you're hyper-focused on your agenda, you begin to see patterns that point to your agenda, and you're going to see data that supports your agenda. And then you're going to publish that, and you're going to say, yes, I've always said it, but no, that's not how it works. You have to have an open mindset. You don't know what to expect. So you need to take care of confounding variables, you need to know that you cannot overgeneralize from just small samples. You need to avoid data bias, whether it's in sampling or whether it's in reporting or the algorithm you use to design your machine learning. You need to avoid bias. It shouldn't overlearn, it shouldn't underlearn, there shouldn't be overrepresentation, there shouldn't be underrepresentation. You know, these are important issues in healthcare data analysis. Also, there is the ethical consideration aspect of it. This data set that you're collecting, do you have right to collect it? Is it personal information? In US, we have something called FIPA. No, IPA in US. In Canada, it's called FIA, right? PHIA. In US, IPA, HI, you know. These are Privacy Portability Acts. You can't just be publishing personal data of people. That is where danger begins to happen. For example, sometimes last year, there was a breach in the United States, and that breach led to the death of the United CEO, as the health organization, United. He was stabbed on the street because some data in his organization were leaked. So ethical considerations matter. And some might be asking, what is a confounder? A confounder variable is simply a third variable in any research that can influence or that influences both the independent and the dependent variable. And it potentially distorts the relationship they have. For example, a prime common example is you are trying to see if there's a relationship between ice cream, right? So you're a researcher. You've been seeing that a lot of people take ice cream, and many of them come down with sunburn. So you couch a research question, or you set out to research, is there a relationship between ice cream and sunburn? In your research, you should know that there could be possible confounders, and such possible confounder is hot temperature. Because the sun is hot, people want to take something chilly. That is why they go on to take ice cream. And because the sun is hot, because the temperature is hot and they're outside, they get sunburn, right? So the confounder in this case is the hot temperature. It affects both the dependent and the independent variable. So if you're not careful of trying to identify all possible sunburn, all possible confounders, you might just come out one day and say, oh, I've done a very lovely research. Ice cream causes sunburn, or there's a correlation between ice cream and sunburn, and you're happy you've done the research. But such research will fall prey of logicians questioning, because he wants to know, are there other variables at play? Is something else causing something else? So these are factors you need to consider while doing your research. Also, you need to learn about statistical significance, which is basically a way of saying, is there evidence of an effect? And practical significance, which is, does this effect really matter in the real world? You need to know why your p-value of 0.05 or 0.01, however the case may be, how it's not everything. P-value just is a probability that tells whether the effect you're seeing is likely due to chance. It does not tell you how big or meaningful the effect is. Let's take an example. If there's a huge data set, right, a very huge data set that runs into millions, a tiny trivial effect can become statistically significant. A small difference can be statistically significant because the data set is large. And then you get a p-value that is less than 0.05. And then you go on to say that the probability that the difference you are seeing is due to chance is less than 0.05. Hence, you accept null hypothesis or you reject you fail to accept null hypothesis, whatever the case may be. Conversely, if you're dealing with a small data set, right, a meaningful effect might not reach significance just because of the low statistical power. These are things you should know and consider in your data analysis. Is what's the power of your sample? What's the power? What's the effect size? How large is your sample? How represented? How it? So we introduce effect size, you measure how large or important the observed effect is, you check mean difference, you use different statistical methods to do that. COENS-D is one standardized mean difference method, right? You do odds ratio or relative risk, right? You do check how to explain the variance in the regression. For example, a large case of COVID-19 data set, suppose you analyze 1 million data sets of COVID cases, and you find that men are 1.5% more likely to be hospitalized than women because, like I said, your data set is running into millions. And from that, you're able to see that men are 1.5 more likely to be hospitalized than women. But if you check the practical importance of the difference, does it matter for policy? If they are 1.5 more likely, how does that affect any policy? How does that affect anything? Does it affect? Maybe, maybe not. That is where effect size and context matters. In the maternity mortality example I talked about earlier, imagine an urban situation where it's just 150 per 100,000 women that die versus rural situation where it's 400 per 100,000 people that die. The p-value that you get from the difference might be greater than 0.05 if the data set is small, right? And what the p-value tells you is that the difference you are seeing is the probability that is happening by chance is greater than 0.05. Normally, based on that, you should conclude that the difference is by chance. But if you bring it to practical sense, you will see that the difference is not by chance. 250 deaths per 100,000 births is the difference. It's such a huge difference between urban and rural settings. A lot is happening that needs to be fixed. But if you're depending on just statistical significance, it tells you that the difference you are seeing is likely, the probability that is happening by chance is greater than 0.05. And as such, you accept or you fail to reject the null hypothesis, which says that there's no statistical significant difference between the maternal mortality rates in urban and rural settings. So these are the things that you need to understand in your research. You need to understand in your publication. You need to understand while suggesting to policymakers, while discussing with stakeholders, while talking to your superiors, or even while just sharing information with people. You need to know if statistical significance really translates into clinical or practical significance. So let's do a quick case study to wrap it up. And this is a dummy data set, right? Mock data set from WHO GLASS. GLASS is Global Antimicrobial Surveillance. It's on WHO. It's something WHO is particularly interested in. So this is a dummy data set. Now, suppose you have two regions, north and south. You're collecting E. coli isolates and their resistance to ciprofloxacin between the period of 2018 and 2022. The first thing, like I said, you collect your data. After collecting, you clean. So here, what you're seeing is clean data. Region, north and south, year 2018 to 2022, total E. coli isolates, these, ciprofloxacin, resistance isolates, these, percentage resistance, these. The next thing, you go on to do analysis, descriptive analysis. You begin to check for line chart. You begin to check for trends, in which case you can do line chart, you can do bar graph, whatever. And what does this trend show you? It shows you that resistance in the northern region rose from 30% to 42% over the period of 5 years, right? That's a 12-point increase. Meanwhile, resistance in the south rose from 20% to 28% over the period of 5 years, an 8-point increase. What does this tell us? What it tells us is that there is increase in resistance at the north and at the south, but the increase in the North is more than that of the South, right? So what do? You do simple statistical tests. You do chi-square tests to see if there really is a difference between the resistance rate in those two regions, right? And after doing your chi-square test, in the North, you have 42%, in the South, you have 28%. You do your chi-square test, you get a p-value less than 0.01. What does this mean? There's a statistically significant difference in resistance prevalence between the North and the South, right? Then, does this mean we want to make a policy? No. You have to do other tests to see that the results you are getting here really is telling what is actually happening. So you go on to do what we call effect size or risk ratio. And then you do that, and then you come out with an answer. And the interpretation of the answer is that patients in the North are about 1.5 times more likely to encounter ciprofloxacin-resistant E. coli compared to patients in the South. Now you are sure that, okay, the results you are getting tallies. So you can write your report, you can make your suggestions to policymakers, you can write your recommendations, you can publish your results. So interpretation, resistance is rising in both regions, but higher and faster in the North. This suggests differential antibiotic use, stewardship, or infection control practices. What does this mean to the policymaker? You then recommend, let them strengthen antimicrobial stewardship programs in the northern region. There should be an increase in surveillance granularity. You want to track what particular hospital we are particularly seeing the resistance from. What ward? Is it the antenatal? Is it the OB-GYN? Or is it the orthopedic? You want to know what word you are particularly getting it from. You want to promote rapid diagnostic testing to reduce unnecessary prescription of ciprofloxacin. You want to do a lot of public health education campaign, whether you go to the market square and you do some rallies, or you go to schools and you educate students at schools to not abuse antibiotic, things like that. And then you want to invest in alternative treatment guidelines where ciprofloxacin resistance is high. This is the essence of your research. Everything you've done for the past months or years has to translate to something that matters in real life. It has to translate. People are supposed to benefit from your research. It's not just something that should sit on for some cabinet. It has to translate into a policy. For example, when the Surgeon General report came out, I think in the 70s, let me check. Surgeon General report led to a lot of things. The use of tobacco and smoking drastically reduced on smoking. The 60s, right? And based on their reports, people started reducing how much they used tobacco, how much they smoked, and they began to see a decline in heart disease, lung disease, cancer, OCD, and things like that. That is the beauty of research, where it translates into meaningful policies, where you're able to save lives, million at a time. So to wrap up, the key takeaways is there is a conceptual framework in data analysis. Ask, prepare, process, analyze, share, act, right? So you want to go from these jargons, from this trash to this. So whoever sees this does not know that this is a lovely building in the making. You're the one who makes the lovely building. You make it a lovely building in how you analyze, how you clean, how you analyze, how you write your reports, you provide context, and you make recommendations. So we talked about common pitfalls to avoid, ethical lens to view things from. There are considerations, cultural considerations. If you're working internationally, you'll be culturally aware or sensitive to the people you're working with. There might be differences between what is obtainable in your culture versus their culture. So these are ethical things to consider while working, you know. And then 6 basic problem types generally, whether you want to make a prediction, whether you want to categorize things, whether you want to identify a theme, you want to discover connection, you want to spot something unusual, or you're trying to find a pattern. So that is the whole essence of data analysis, that you're at the end, you're able to make a report and a recommendation that, if followed, will translate into real world activity. Thank you. Feel free to follow me and connect with me on different social platforms. If you have questions, you can just hit me up. You can, connect with me and ask you questions, or just share or like or post whatever that you see on my post and you like. Questions, yes. I see Sumbiko. Please ask your question. A lot of questions. Nice. Please ask your questions.
Hello.
Hello.
I hope you can hear me.
Yes, I can hear you.
Yeah, thank you for the presentation. It has been very impactful, and this is one of the presentations that we have been waiting for, data analysis. And for an undergraduate, this is a very difficult part to understand, and again, how to go about with it. But it has been a privilege to have such a presentation. However, I have a question on the data analysis, specifically on the confidence interval as well as p-values.
Okay.
How would we apply these two? Because in your presentation, you have explained very well that these two, they have to go synergistically. Otherwise, one concept may not make sense. And again, why are they important in data analysis? How can they help us to understand the impact or the significance? Thank you.
Good question. Thank you so much for the question. I'm happy that you've been following and you're able to ask your questions. So, first of all, on the issue of confidence interval, let me explain it in a way that is very understandable to everybody. I will explain it in plain terms. I will jettison all the statistical jargon. So what does confidence interval mean? What does it mean? It means that we want to be able to say with certain level of confidence that this result we have seen is accurate, right? Now, in social sciences, they set confidence interval to 95. In health sciences or matters of life and death, they can't afford a 5% chance. So they go on to set it to 99% because they want to be as accurate as possible. Imagine if you're sending someone to the moon for the first time. Imagine you're Elon Musk and you're talking of SpaceX, you've designed SpaceX for the first time, and you're sending a whole human being to launch it, and you want to see, and you're doing your statistics, and you are saying, we can say with 95 confidence that this person will go and come back. No, it doesn't work that way. It's a whole person's life. You need more than 95%. You need to be more sure. You need to be able to speak with more confidence that this person will survive this surgery, or this person will go and come back, things like that. So that is what confidence interval is. You set it as high as 95, 99% if it's really a matter of life and death. In many health sciences, is 99%, but in social sciences, where it doesn't really matter as much, they set it to 95%. Now, p-value or alpha value is we also call it a significant level. It is, so if it's 95% confidence interval, p-value is 0.05, 5% to make it 100%. If it's 99% confidence interval, the significant level is 0.01. What we are saying, the P there stands for probability. The probability that what we are seeing is due to chance has to be less than 0.05 or 0.01 for us to accept a null hypothesis that you will have defined in your questioning. Maybe your null hypothesis will say there is no statistical significance difference between male and female in coming down with COVID-19. For example, if that's the hypothesis, there's no null hypothesis, there's no statistical significant difference between male and female, then alternate hypothesis, there is a statistical significant difference, right? You go on to do your analysis, you have your confidence interval set at 95% or 99%, however the case may be, then you have your p-value, and your p-value is the probability that the difference you are seeing is due to chance has to be less than the significant level for you to accept or fail to reject the null or alternate hypothesis, depending on whether you are doing a parametric test or otherwise. Does that help? Questioner, does that help?
I think we have like 2 other questions. People raising their hands.
Yeah. Okay, I just wanted to know if the questioner.
Oh, I think, was it Timbiko that asked that question, or who asked it?
Yeah.
Yes, we understood.
Okay, thank you. Thank you. Right, I see Alison Innocent. Alisa Innocent.
Alisa and Anas.
Yeah, thank you so much for the wonderful presentation and an opportunity to ask my question. So my question is on recommendations and on what should be done. Is it the researcher who suggests what should be done, or the decision makers who suggest what to be done? Thank you.
Thank you for the question. No, this question that you've asked is one of the questions I asked for a long time when I joined Johns Hopkins. The way things are done in the developed world is totally different from how things are done in our LMICs, right? So in the developed world, there are 3 major groups, right? There is the policymaker who needs information or support of the domain knowledge experts. And the domain knowledge experts needs information from maybe its pressure group or the community, the people who are going to be affected. So in developed world, things are done in synergy. No one just goes to the Senate to make any recommendation or to make any policy without having consulting the experts and the people on the ground, the people who are going to be affected by your policies, right? So that's why we do things like town hall meeting, we do things like pressure group, want to understand what they're doing. There is a course I took, it's about program planning. You interface a lot with the people. It's about the people. The policy man is there because of the people. The scientist is there because of the people. Whatever research you are doing is for the people. So there is always a regular interface between you and the people. So if you are interfacing with the people, you know what they need, you know what they want, you're doing your research, you know what your research says. Now, because you are the expert, you've gotten your results, you've gotten your research, you are now suggesting to the policymaker, because it's the policymaker that goes to the house to make your case. It's when he's able to make your case or make the case based on the information you're giving him, that it then turns to policy. But in our side of the world, things don't work that way. You see, someone just goes to the house and he makes one policy without consulting the people or without consulting any domain knowledge experts. But to answer your question, how things are supposed to be done, everybody works in synergy. You as the expert, as the domain knowledge experts, you are making recommendations to the person who is able to turn your recommendation into a law. You don't have the power to turn your recommendation into a law because you're not a policymaker, right? So you make your recommendation to the policymaker, and then it turns it into law. But you have consulted with the people on ground. And because you are consulting with the people on ground want the policymaker because they know he will do what they want. They vote for him. You see how these things work hand in hand. At least
Questions.
Yeah, I can. Thank you for your response.
Yeah, because of
Yeah,
time, I think we might just be able to take just Vincent, you already asked the question. So Anna's and Amino, if you could just do it in 1 minute, please just wrap up. I think there's some questions in the chat box too, so we have to just go ahead.
your line is breaking up a lot.
Sir?
Your line is breaking up a lot. I couldn't hear you.
Okay. Good evening, everyone. I am Anas Alkasim, an undergraduate student from Bayero University, Kano State, Nigeria.
Good evening. Thank you for being here.
Okay, sir. Before I go to my question, actually my question goes to my Ezine also. But before I go to my question, I would like to appreciate you, sir, for this session. The session is indeed going to be an impactful one to us. Thank you very much, sir.
Thank you.
My question is based on the abstract template that was sent to us via email. I have seen that in the template, we are required to form the abstract based on background, research objectives, methodology, and then analysis and findings. But some of us are still on their project and have not yet concluded. And I think for you to write a method and highlight your findings, it requires a data. But some of us are not having the data; they have not even concluded. So, how is it going to be? Thank you, ma.
Yeah.
And
I mean,
my last question is, what's the deadline for submission?
Okay, thank you. Maybe
Thank
you
you, ma.
joined the call late because when we started the call, we talked about this earlier. But I mean, yes, I know that some people have not started their project, and that's why we said if in the research and the findings, right? If you don't have your finding, you can just put like an hypothesis. You can see it also have like slash hypothesis. So yes, I know Sam had said on this call that, you don't expect something from your research, but just tell us what you hope to get, right? Is advanced to what he taught us today, but what do you expect to see from your research? How do you going to get the data? How do you plan to analyze the data? Just a summary, right? And the deadline, there's no deadline. Just on Saturday when you're coming for the session, make sure you have it handy because you don't know if you'll be the one to be called on to present. Yeah. Thank you. So yeah, let's have the last question.
Okay, thank you, ma.
Yeah. Yes, thank you very much. Aminu,
Yes,
Aminu, go ahead.
guys, good evening, good afternoon from wherever you are. My name is Amin Mohammed Bello, and I am a medical laboratory science student from Al Istiqama University, Kano, Nigeria. My question is regarding the confounding factor the facilitator brought on earlier. So I need some elaboration. And also I saw a colleague also asking on attribution factor. How can we like differentiate between these? Thank you very much.
All right.
So Sam, there's also a question by El Menora on the page. So if you want to take everything at once.
Say that again, please.
There's a question in the chat box by El Menora rather. So he has like 3 questions. Yeah.
Let me just check that.
And then the confounding and attrition factor. So thank you.
So let's talk about confounders. That's, like I said, confounding variable. A confounder is a variable that affects both the independent and the dependent variable, and hence it affects the relationship that exists between them. And it can distort your results or your reports if you're not careful. So what do you do when you are seeing a relationship, the existence of a relationship between independent and a dependent variable? Do not quickly conclude that based on the relationship alone, maybe you've done some chi-square test or you've done some correlation and you're saying there's a strong positive relationship or a strong negative, whatever relationship. Don't be quick to conclude on that because there could be a confounder that is affecting both. So don't go on to say A causes B. It might be that there is a third party that is affecting A and also affecting B, right? And hence the relationship that exists between them. As such third factor is called a confounder. The example I used earlier, I don't know if you got it. A researcher has noticed, okay, let's do another easy to understand example. A researcher has noticed that, I think I saw this research while I was a student in Hopkins. Whenever it rains, there is high crime like that. I'm not so sure, right? And then you do some research and then you go on to determine that there is a probability that weather affects crime rate. What I'm saying is, don't be quick to make such assertion. There could be a third party or a third factor affecting both crime rates and weather. And such third factor is called a confounder. Such factor needs to be addressed. You need to know whether it's actually the third factor that is responsible for the effect you're seeing, or that is responsible for the independent variable you're seeing. If the third factor is responsible for the effect, and you've already said it's the independent variable, you see how wrong you are. And if the third party is what is affecting the independent variable, and you've gone on to say it's the independent variable that is causing the effect you're seeing, you see how wrong you are. So a confounder is that third factor that affects the two. So the second thing you asked is attribute factor. Did I get that right?
Yes, sir. Yes, sir. Yes, sir. Yes, sir. You got that right.
I don't know what an attribute factor is. I've not heard of that. What I know is an attribute. An attribute is like a variable of a thing. So there is an observation, and then there are attributes of the observation. So for example, you are an observation in a data sheet. If, for example, we want to take statistics of those that have attended this Zoom call, you are a variable, you are an observation in it, just like I am, just like Ezine is, just like Israel is, and everyone is, right? You have different attributes. One of the attributes will be, what's your name? Your name is an attribute. Your gender is an attribute. The time you joined is an attribute. Whether you ask the question is an attribute. So all these are variables of each of the observations. So imagine a spreadsheet. On your rows, you have observation. Each row is an observation. And each column is an attribute of each of the observations. Where we have, for example, gender, observation 1, male, observation 2 might be female. Name, observation 1, Samuel, observation 2 might be Ezine. Attribute 2 might be Ezine. Attribute of observation 2 might be Ezine. So that is what an attribute is.
All right, thank you so much, Sam. I hope that answers the question. I feel like data analysis is very, very important, right? It's a very, very important topic. You guys will not know the importance of data.
Attrition. So,
Yeah,
okay, I just said
attrition.
this.
Yeah.
Oh, I thought it said attributes. Okay, so attrition is like when you churn, when you remove. Okay, so yeah, good question. There's something we call factor selection or attribute selection. I can't remember this term now. So for example, sorry for taking your time, but I'm just going to quickly explain this. For example, if you're running a research and you're doing correlation between two things, yeah? And you see that there is a strong positive correlation as high as +1. It means A is 100% correlated to B. That means A is saying exactly what B is saying. When doing data science or data analysis, what we do in such situation, we do factor selection. In factor selection, we remove such situations where there is collinearity or multi-collinearity. Multi-collinearity is when different factors or different variables are strongly correlated together, as strong as +1 or -1. It means each of these variables is saying the same thing. If 10 things are saying the same thing, we only need one thing to say it. In such situation, we remove the 9 other things because it's called noise. In machine learning, we call it noise because it's just going to affect whatever algorithm you're trying to build. So you remove all the noise. We call it factor selection, variable selection, feature selection, right? You remove all the noise because they all say the same thing. You pick the one with the highest contribution. So that's it.
Yes, thank you so much. So there's a question by Elnora. It's a lot, but I think probably you've touched it. The null hypothesis, right? if they're allowed to approach analysis in a data with perceived arguments, then how do we check if the data was actually collected and not forged?
I was carried away. I was trying to read it. I see a question about null hypothesis. If you are not allowed to approach analyzing the data with perceived arguments, how do we check if the data was actually collected and not forged? So that comes down to primary source, secondary source. If you're getting, most likely it's not forged because you're the boot on the ground collecting it. Like, right? If you go to the laboratory and you collect blood pressure, you're the one writing down the reading. Such result is definitely primary source. And as such, you know it's not forged. Now, for secondary sources, you cannot be so sure because you don't know who did it, how they did it. You really don't know. So you might not be so sure, although you might be seeing some phony results, and then you know that this result is wrong. That's that about that. About the null hypothesis, if you are not allowed to approach analyzing data with the perceived argument. So yes, there is null hypothesis and alternate hypothesis. Null and alternate are like opposites. Null says something. Generally, null is on the negation. There is no relationship between this and that. If you're looking for a relationship, but there is no significant difference. If you're looking for difference in means, you know, and then alternate says there is a significant difference or there's a significant relationship. Generally, that's how it works. There is no statistical significant difference between the rate at which male and female do so thing. That's null. And then alternate says there is a statistical significant difference. That's how you have your null and alternate.
Yeah, thank you so much, Samuel, for today's session. I feel like this has been a whole lot more than, I'm sure a lot of the students are already brain saturated. Data analysis is a very, very, very important aspect of, public health career. Whether you're how will I call it, whether you're still a student or whether you are in your profession, you need data. I remember when I started working, my very first job after graduating was, in a public health organization, Clinton Health Access Initiative, and I had to do a lot of data analysis, right? Because I was working on a project, even though my role was not project data analysis, I was working on a project and I had to analyze data to tell my boss what was happening, right? Giving feedback on how the project is progressing. So this is it's not something that we can do in 1 hour. And this was just to introduce you to the concept of data analysis and how important that is. I'm sure that, Mr. Samuel here is very open to, guiding you. If you reach out to him on LinkedIn or social media, I'm going to share the slide which had his access to his social media handles. So follow him. If you have questions on your research, I'm sure he'll be willing to guide you. I'm just putting them on the spot because I know they're very busy. But I'm sure that if you mention that Izini asked me to reach out to I attended your training, I need guidance, I need you to look at this for me, he'll be very willing to do that for you. Sam, am I right? Yes. So thank you.
Yeah, if you reach out, I'll be glad to help.
Thank you, Sam. Yeah, I really appreciate that. So please reach out to him, connect with him on LinkedIn and social media. This is very, very important, very, very important aspect of it. Whether you are an undergrad, master student, you need to know how to analyze data. We didn't talk about tools, data analytics tools, but I saw some people ask question. I put it on the chat, a free online course you can take on data analysis. There are a lot of online courses you can take right now. One of the things we'll talk about during the final Saturday session is what you can do to upskill yourself as undergrad. What do you need to start doing today? How do you begin to position yourself? What certificates do you need? What courses do you need to take, right? A couple of you are already doing it. I'm beginning to see some people just coming on social media for the first time, posting about their journey. It's what we want to see at the end of this session, that you move beyond just an ordinary, public health career or professional to be global standard. And that's the difference between students in the third world like the US and undergrad students in Africa. And yeah, so we really want to say a big thank you to Mr. Samuel. Please let's give him a digital clap and thank him for, the opportunity to learn from his wealth of experience. He's very good in AI, machine learning, data analytics, bioinformatics, anything healthcare data. He's very good in it. So please make sure you reach out to him and make sure you use the resources you have. So yeah, thank you so much. I think somebody was asking about the abstract session. So yes, we talked about this earlier, and the purpose of this is to make sure that you practicalize the knowledge you've got from this, right? How do you structure your research? How do you communicate your research? I mean, we've already had sessions on communicating your research. We've had session on foundation of research, right? We've had sessions on writing an abstract. We've had sessions on methodology. Today now is the data analytics session, right? So basically that's 4 buckets, right? You need to just concise your research topic, what you are working on, what's the background, what's the current state of things, what's the epidemiology, what's the prevalence of this disease in where I'm working, what is the incidence, right? Just brief background. And then you talk about your methodology or your objective, right? Why am I doing this research? Like I said, that's the question you're going to put in, answer you're going to put there. Why is this research important? What am I looking to get out of this research, right? And then the other section is the methodology. How am I going to find out about these questions? Well, how do I want to go about this research I'm doing, right? Ms. Anu taught us about qualitative and quantitative methodology, research topic, and all of those things. So just you can go through the sessions we had. We sent out the link already. If you want to listen to it again, listen to it, and just write something there. Then for the last session, which is the finding, the analysis, and the hypothesis, basically some of you have not started your research, so it's okay if you don't have anything there. If you don't have any findings right now, you can just tell us an hypothesis of what you think that will happen based on the research paper you've read, right? Don't assume, but just tell us your hypothesis. Do you understand? That would help us to, I mean, this is an opportunity for you to practicalize. Like I said, in the US, that's what they do, poster presentation. That template I sent is it's called poster presentation. Even Samuel can tell you in Hopkins, he did that too, because you have to do a poster presentation on what you plan to work on, and that's where you get possible collaborators to support your research projects. Just this is an opportunity for you to practice, and use it. Yeah, the template was sent on email on Sunday, so check. You'll find the link on the email to download the link. Don't ask for edit access. Just download the template and work on it. If you don't have access to it, please reach out to us. We'll send it to you personally. So yeah, we're looking forward to Saturday session. Please, this is not just for people who applied. Feel free to share with your classmates to come and join, because that's an opportunity for them to learn. There's going to be a panel. Mr. Samuel will also be available for those of you who are looking to branch into other aspects for microbiology. We're going to have doctors, pharmacists from different part of the world, right? They're going to tell us the question they're going to answer is what they wish they knew before their undergrad research and what they wish they knew before they graduated from their undergrad. I feel like that's the gift of exposure, because they have been exposed and they will tell you what you can start doing. The courses you can take online, the places you can start, the collaboration, the scholarship, the fellowship. When I was undergrad, I didn't even know that I can even travel out of the country and do a collaboration with another university in the US while I'm still an undergrad. All these things, I didn't know them until I graduated. So we hope that you are able to share this knowledge with everyone and you're able to do better for yourself, position yourself to do better. Yeah. So thank you so much. Yes, there's not going to be a class on Wednesday. It's going to be merged with Saturday session because it's almost the same objective. So we're going to merge the Wednesday session with Saturday. So just prepare for Saturday. Yeah. And the Saturday session is going to happen early. There's no session tomorrow. Saturday session is going to happen earlier than usual. So we'll send out communication based on the availability of our speakers to you on the time for Saturday session. So thank you, everyone. Thank you, Mr. Samuel. We are really grateful on behalf of HSB. We are grateful for this session and we thank you for making our time for it. Yeah. Do you have any last word to say, sir? Mr. Samuel?
Yeah, I just wanted to say thank you for having me.
Sure. Okay. Please reach out to him if you have questions. I mean, reach out to Mr. Samuel. If your question was not answered, reach out to him. His name is Samuel Lateef on LinkedIn. So you can find him on LinkedIn and connect with him. Yeah. If you have questions that have not been answered. Yeah, so the only session that is left is Saturday session. There won't be any other class. Saturdays are final day.
I don't know, isn't it? Are you able to share my LinkedIn or Instagram with them so that
so you can find him on LinkedIn. His name is Samuel Lateef, but we'll send you like I said, we'll send you the document with all the LinkedIn profiles of the speakers who have taught us here. Yeah, somebody's asking about the WhatsApp group. Yeah, we'll create a WhatsApp group and send it via email. Expect it on Wednesday with all the recordings and the LinkedIn profile of those speakers. Yeah. All right. Thank you so much, everyone. Look forward to meeting you guys on Saturday. Yeah, Abigail, yeah, don't worry about it. It's fine. Yeah, we'll see you on Saturday. All right, guys. Bye.